Do you feel pressure in your ear? Do you feel like you're hearing underwater? Do you have a hearing deficit? Do you feel like your eustachian tube is always closed, and like when you go in an airplane and try and pop open your ears when you're climbing an elevation, but you just can't do it? There's a condition called eustachian tube dysfunction. If you're dealing with any of the symptoms I just mentioned, that's most likely what's going on. And if you're dealing with eustachian tube dysfunction, there's usually a complex of other symptoms that are often associated, like vertigo, ringing in the ears, cognitive fog. Often these patients have TMJ and popping in the jaw joint, pressure at the back of the head, and neck pain. And the reason all of these things kind of are connected is the upper cervical spine, the top two vertebrae, this one namely called the atlas C1, which fits right under the skull. These complex of symptoms are usually associated with a structural misalignment of the floor of the skull, because your vestibular center, which controls balance, is located in the brainstem, which is inside of this vertebra. And with regards to eustachian tube dysfunction, you have a group of muscles inside the eustachian tube wall. And when they become tight, kind of like your shoulder muscle can become tight, that eustachian tube can close. And that's where the fullness and the wet ear syndrome that people experience, and the pressure that's associated. And oftentimes the ear pain is associated with all the musculature in that area being locked down. So what do you got to do if you want to get to the root cause of why it's happening in the first place? You need to get to someone who's trained in upper cervical chiropractic. These doctors focus on the top two vertebrae of the neck, the relationship to the spinal cord. And what happens to most of these cases, as was elucidated by a doctor, Dr. Burkhan up in Grand Rapids, Michigan. He's published several peer-reviewed journal research articles on Meniere's disease and the upper cervical neck. And what he found was the average patient suffered from a trauma about 10 years prior to the onset of their Meniere's symptoms. So what happens is when you have a blunt trauma, car accident, whiplash trauma, whatever, and that top vertebra structurally misaligns under the skull, it tears the soft tissue surrounding the joint, and the joint gets locked. And when the joint doesn't move the way it's supposed to, it irritates the nervous system, causes aberration through the system, causes the muscles to become imbalanced, causes the muscles in the eustachian tube wall to become spasm, and that's what closes it. And then there's a cascade of neurophysiological effects that ensue. So if you want to get to the root cause, most often the root cause of these types of problems is upper cervical misalignment. We have an office here in Sarasota, Florida. We do offer a free consultation. If you're outside Sarasota, Florida, you can go to a website, www.uccnearme.com, that houses doctors throughout the world that can help you.